Nigeria has no functional national policy on the care and welfare of older persons. Now, this, according to the Emem Omokaro of the Africa Institute on Aging and Development, presents unique challenges to the older persons in Nigeria. Correspondent habidah lawal now reports.
In the face of rapid demographic change, one of the major challenges facing Nigeria is developing policies and appointing personnel capable of responding to the complex needs of the aged. The demography of aging is creating new challenges. Such challenges include protecting the rights of people living with dementia, older detainees, and the equitable allocation of resources in healthcare. The Omokaro Institute leads advocacy on the institutional and policy capacity development in aging. It wants great.
All right, now joining us for more on this is Executive Director Dave Omokaro, Institute on Aging and Development, and she's Dr. Emem Omokaro. Many thanks for joining us on TVC News at 10. Indeed, the aging population is getting wider by the day. What exactly are the challenges for a peculiar nation like ours?
Thank you very much for having me. Yes, of course, the absolute numbers of older persons are rapidly increasing. And the main challenges of older persons would be health, access to health. Of course, you know that with aging comes some chronic conditions, rising incidence of non-communicable diseases. And of course, you know that older persons in Nigeria are still paying out of pocket. They really have no access to health insurance, as it were. And of course, most of them live in the rural areas. Access to medical care, access to even primary care opportunities. They do not have access to those things. And then, of course, it will also be financial inclusion for those ones who are still full of vigor and they want to continue their businesses. They are discriminated against. You have stereotypes, prejudices against older persons, that because they are old, they really have nothing to offer. So they are financially excluded. And you also have the situations where older persons do not have access to justice because they do not have access. Right. They don't even understand their rights. And they deny their rights.
Okay, perhaps one other challenge to actually fixing this problem would be the issue of data. So what do you suggest as an organization, what government and individuals can do to actually better the situation?
Yes, of course, you know, it's often said that what you don't count, what you cannot count does not count. And talking about issues of data, and you know that national surveys are on demand. When the government finds need for use of national surveys, they make demand on the National Bureau of Statistics. Older persons, indeed, are not always included in national surveys. National surveys of well-being, national surveys of malaria exclude older persons. So now is the time, indeed, to have surveys, multi-indicator surveys on older persons to know where they are located, to know their particular challenges, and not just data for the sake of data, disaggregated data. You cannot lump older persons from category 60 to 80. Sometimes you find 30 years to 70 years, the gap when they are talking about the incidence of non-communicable diseases. So yes, for anything, for any strategic plan on aging, to meet issues and challenges of older persons, yes, we need data. So we would encourage government to, issue the demand for data, the National Population Commission to disaggregate data. And of course, we in the Institute, we are working with the Nigerian universities on researches on issues of older person, on thematic areas, and all this pool of data, when they are harmonized, will really help to work with governments to have strategic plans for older persons.
Okay, Dr. Emem Omokaro, Executive Director, Dave Omokaro, Institute on Aging and Development. Many thanks for joining us on TVC News.